Okay, good morning. So today we're going to discuss the topics on strokes, brain disorders, right? And of course about arthritis, the different forms of arthritis, and musculoskeletal disorders. But first, let's deal with the most important topic, which has to do with what? Strokes. Now, can anybody tell me what's another name for a stroke, class?
Cerebral vascular accident.
Cerebral vascular accident. So by the mere fact it's called cerebral, what organ is involved here?
The brain.
Brain. And when you say vascular, what is affected here in the brain? The blood vessels. But now see, if you were to give me a very specific, exact answer, it has to be more than blood vessels. What exactly am I referring to? Cerebral arteries or cerebral veins?
Arteries.
Why cerebral arteries? What do they carry with them? Is it the pressure? Is it the amount of blood and the blood components?
Blood.
What is in the arterial blood that's important for the brain cells?
Oxygen.
Perfect. You have to think fast and act fast, answer fast. In a patient with cerebral vascular accident, or what we call CVA, it's also known as CVD, cerebral vascular accident or cerebral vascular disease, the organ involved is the brain. Correct? At the same time, what is affected would be what? The cerebral what? Arteries. Okay? And what are the arteries going to do? They supply the brain with what? Oxygenated blood. Do you understand? Okay? So arteries, oxygen, blood. What did I put on this whiteboard? Only what? Keywords or keywords? So these keywords you have to what? Forget or remember all the time until you die. Okay? A stroke will always be a stroke. 100 years from now, I will be 157 and you'll probably be what? I don't know how old you will be, 120. And I'll be walking towards you and say, remember me? Okay? What is the meaning of a stroke? What is CVA? The answer will remain the same, right? Okay? So, based on your readings, we know that there are different forms of strokes. Okay? So you have what kind of strokes? Ischemic infarct, right? Strokes. And then what's the other one? Hemorrhagic. Under ischemic, you can subdivide this into two. What are these two? So in other words, what is found in an ischemic stroke? What causes it? Okay, so thrombotic. And what's the other one?
Embolic.
And embolic. And what is exactly a thrombus, class?
It's a blood clot that forms usually on the
It's a blood clot that forms where?
on an atherosclerotic plaque.
Atherosclerotic plaque, which is found where? In this case? The arteries of the brain, exactly, right? So you have a plaque, which is fat deposit. Will that be a good breeding place for a clot to form? Yes, fat deposit that narrows the lumen, right? So you have a clot. What kind of clot? Stationary or throbbing?
Stationary.
And that exactly is the definition of what? Thrombus. On the other hand, an embolus is what? Okay, a traveling clot. A blood clot, right? Now, if this were therefore the artery like this, the fat deposits here, and therefore it facilitates the deposition of fat, which causes you to develop what? A clot, right? Okay? So if you have hypercholesterolemia, so the same mechanism as that for the coronary artery disease, wherever fat goes, it can go to the arteries of the coronary arteries of the heart, it can also go to the brain, right? So, you end up with the blood what? The blood clot, right? Okay, now the question is, it's stationary because it's attached where? To the wall, right? So both of these, you have a blood clot. Here, hemorrhagic, the artery ruptured or burst. There's bleeding. But here, clot, stationary clot, traveling clot. So, what would you expect to happen in these patients with a blood clot? What kind of paralysis would you expect? Would it be paraplegia, quadriplegia, or hemiplegia? Okay, what is hemi? Half of the body is what? Paralyzed, right? Paraplegia is paralysis of what? The lower limbs, both lower limbs. What about quadriplegia? All four limbs. Quad means four. Plegia means complete paralysis. Paresis means partial paralysis. Like hemiparesis or hemiplegia. You see the difference? When I tell my students, my patient suffers from left hemiplegia, that means half of the body is paralyzed completely, not move. Hemiparesis means I can do this, I can do this. The patient is hemiparetic, okay? So if you have a lesion on the right side of the brain, what will be affected? Why? Why, Miss Lori?
Because the right side of the brain controls the left side of the body.
Why? So you notice? How do people become smarter? They always ask themselves, how, where, when, why? Where? In the brain. Arteries? What part of the brain? Why would they be paralyzed on the opposite side?
I'm not 100% sure.
It's okay? It's the purpose of teach back. The doctor or the teacher is here to find out how much you know, and you're supposed to teach back to me what you have learned, both on anatomy and here. But why is it that the right side of the brain controls the left side and the left side controls the right side?
Does the nerves cross?
Yes, Ms. Romero?
Does the nerves cross from one side to
The nerve fiber tract crosses, remember? If you remember, if you were from former student in anatomy, I said I compared them to what? A telephone wire. Have you ever seen a telephone wire? If you cut the wire, you have red, green, blue. So every wire represents a particular muscle. Then where do they all originate from? What part of the brain is considered the primary motor area or motor cortex?
medulla?
You're my former student, Ms. Romero. When did you take anatomy with me?
A while back.
And when you say a year ago, I presume, right? It's okay, forget. And this young lady to your left, Karen Ong, you were also my former student. Where do you find the primary motor area? Yes? Anybody who was my former student? Miss Narcisian, you were my former student, right? Lilith, where is the primary motor area? Yes, Ms. Romero?
Is that the prefrontal cortex?
Prefrontal cortex or the frontal lobe? Is it the precentral gyrus of the frontal lobe? Can you afford to forget that word? Precentral gyrus of the frontal lobe? No, you cannot. Why not? That controls all the movements you do. If I go like this, or kick the ball, it's the frontal lobe. Where is the frontal lobe found? In front or at the back? Don't you love anatomy? I love anatomy. I'm in love. I love anatomy more than my wife, okay? I'm just joking, of course. My wife is more important than anatomy. The frontal lobe, primary motor cortex, part of it, the precentral gyrus. What about the primary sensory cortex, the parietal lobe? Which part? The postcentral gyrus. So you might think, oh, I learned that in 2 years, 3 years ago, or if I took anatomy for. So you see how it keeps on coming back? It's the reason why learning is cumulative. It's never forgetting things. Okay, anyway. So you have hemiplegia. What kind of hemiplegia? Contralateral or ipsilateral? You know what contralateral means?
On the other side.
Opposite side. So as we said, the right side controls what? The left side of the body. Why? Because if you were to look at me like this, is it still working? So to be sure, I might be talking for nothing. So the right side of the brain, the nerve fiber tract come from the frontal lobe, the precentral gyrus, they go down like this. And then they cross where? In the medulla oblongata, to the left side, they go down on the left side of the spinal cord. So all the spinal nerves here, in fact, actually came from where? The right. All the spinal nerves on the right, spinal nerves that become the nerves like radial nerve, musculocutaneous nerve, median nerve, they actually came from where? From the left. And where did the fibers cross or decussate? You will have this in your notes. Decussate means to cross. Crossing of the nerve fibers tract. Or crossing, right? Will occur where? In the medulla oblongata. In the brainstem. Will this come out in the nursing board exam? 100% sure. When I did review nurses for 8 years, the question was very simple. A patient was brought to the emergency room with left hemiplegia. Which part of the brain is affected? And you have a choice. Right frontal lobe, right parietal lobe, blah, 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 blah. Left frontal lobe, right frontal lobe. So you have to think, what did I learn in Dr. Gamo's class? The answer is right, because the problem is on the left. That means the opposite contralateral portion of the brain is affected. Do you understand? Okay? So this is something very important. Okay? So will there be possible sensory loss? Maybe. Okay. Will there be problem with speech? Yes. Like aphasia. What is aphasia? I know there will be a group reporting on this, right? Who is that group? Who was assigned to stroke? Okay, what is aphasia, my dear? Do you know what's aphasia?
It's a language deficit that occurs after.
Language deficit, okay. What about dysarthria? Do you know what is dysarthria? Okay, let me answer my own question. Does anybody, unless somebody else knows? It's called slurred speech. Slurred. Now, aphasia is language problem. I'll tell you, for example. In our brain, we have what we call speech centers. Speech centers. They're called Broca's area and Wernicke's area. Anyway, you can go back to this in anatomy. Now look at me. Let's say Dr. Gamo is a 57-year-old male patient who suffered a stroke. Unfortunately, the left side of the brain is the speech center. What part of the brain? The left. So I'm paralyzed where?
Right.
The right. Okay. Lights, camera, action. Ask me my name and where do I live?
What's your name and where do you live?
Okay. My name is Dr. Joel Gamo. I live in Anaheim, California. And what is your work? Ask me.
What is your work?
My work is to teach students in the best profession in the world, which is nursing. Okay. Now this time, God forbid, I suffered a stroke. I'm paralyzed on the right side. Now ask me all the 3 questions I asked. Let me see if you remember the questions you were supposed to ask your patients.
What is your name?
Okay. Okay. One question at a time. You don't want to overwhelm the patient. So what is your first question?
What is your name?
Second question.
Where do you live? Disneyland.
Third question.
What do you do? Yeah, what do you
Where
do?
do you work?
Where do you work? You're an artist.
That's how difficult an aphasic patient can be. See? You said an artist, right? Because how can I tell you that I'm a teacher? And I can even open my mouth, right? I'm aphasic, right? It's called expressive aphasia. Expressive means I understand what you're saying, but I cannot tell you what it is. So is it helpful to give them with a communication board? Exactly. Are you an LVN? That's why they know. Okay. Because it's really helpful if you're an LVN before you take up RN. So the communication board is designed. The word hungry, the word eat is there. You just point, right? Or what is your work? Engineer, doctor, nurse. They put nurse or teacher. You can point. Do you understand? Is it important to have a communication board, or you can have a whiteboard? So if I'm paralyzed on the right side, can I use my left hand to write things I want?
Yes.
Definitely. Right? I remember when my dad suffered a stroke. The good thing it was on the left side, so the right was affected, right? So did he have aphasia? No. So this is what he had. Okay. So let's pretend I'm my father, and I suffered a stroke on what? The right side of my brain this time, which is not the speech center. Okay, ask me the question. Same questions you asked me.
What is your name?
My name is Dr. Gamo. Okay. Next question.
Where do you live?
I live in California. And what is your work? Okay, ask me. I teach nursing students, the best profession in the world. What kind of speech is that? And what is dysarthria? What is dysarthria? And you know how to spell slurred. I don't have to write it down. I don't want to waste my ink, right? You understand what I'm saying? So is there a difference in slurred speech and aphasic patients? So which is more difficult for a patient to accept? Part of emotional aphasia. Can you imagine? You were a lawyer for Harry Weinstein. You know him. Okay. He's gonna be arrested today. So I'm now his lawyer. I'm here in front of the judge, and Harry Weinstein is my client. Objection, Your Honor! On the ground, blah 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 blah. Now, can you imagine if you happen a stroke and you become aphasic? I can't. I lose my job. I can't work. Can you imagine the psychological impact on this patient? Now, so what kind of hemiplegia would expect here? Is it going to be sudden or gradual weakness? So gradual weakness is called step ladder fashion of weakness. Can anybody explain to me what is that? I'll give you an example. The patient with a thrombotic type of stroke, it takes time for the clot to develop, right? So let's say it's only partial. So you have what? A. You ask the patient, when did you have paralysis of half of your body? I say, oh, last night, Dr. Gamo, at 6 in the evening, I could do this. I could notice there was weakness, but I ignored it, At 12 midnight, I didn't want to go to the emergency room. Instead of this, it's now going like this. And when I woke up in the morning, the clot was already full. Guess what? I can no longer move my arms and leg. Is that gradual? So from 6 p.m. to 6 a.m., in the span of 12 hours, oh, it's at 12 hours, yes. Guess what happened? The partial to complete paralysis. Okay, it's what you call a completed stroke. Stroke and evolution. What about embolic? Sudden or gradual? Sudden. Why? What's a normal common source of clot in patients with stroke? Which chamber of the heart is affected? I'm giving you the answer already. It's called cardioembolic stroke, right? Where is the heart chamber that causes you to develop a stroke? Left what? Left atrium and left ventricle, right? Between the two, which one is the best answer?
Atrium.
Well, ventricle, why? Because it's where the blood clot comes into the aorta, but it can also start in the atrium. Remember, if it's for the heart, the septum is here, the left atrium is here, mitral valve, left ventricle, the valve is here. So when you have atrial fibrillation, you know what's atrial fibrillation? AF? Irregular heartbeat. Now what happens here? Now remember, when the heart pumps blood regularly, what happens to the blood? There's continuous movement, right, into the aorta, right? In other words, there's never a dull moment. When there is continuous pumping action of the blood by the heart, there is continuous movement of the blood. Now look what happens if you have an arrhythmia or irregular rhythm, such as atrial fibrillation. Now, especially if you have a skip beat. So that portion is a few milliseconds, but will that be enough, because the heart is not pumping at all in that period of time, will that be enough to cause a clot to form? Yeah. Now, try this experiment. When you go home, cut yourself, get the blood, and put them. I'm just kidding. When I was a young boy, we used to have this. The blood, we put them in what? In a container that is not moving. And you put the blood in a container that's moving. What happens if you move the container? There is no blood clot. On the other hand, if you keep the blood inside the container that's not moving, what happens to the blood? It coagulates, so it clots. Because there's no movement. So that period of time when the heart is temporarily not pumping anything, will the clot form? So by the time it pumps, bang, guess what? Goes to the aortic arch, and then what? The left what? Common carotid or brachiocephalic, subclavian, and then what? Right common carotid. So it can go directly to where? The brain. So it's called cardioembolic. Now what about a clot that came from the carotid, the neck? Or plaque here, plaque fat deposits. Remember the fat? Is that dangerous? It can also go to the brain. So the possible sources of a clot could either be the heart or a clot in the neck, in the carotid arteries, because that is the destination. That's how the blood goes into the brain. Do you understand? Okay? So sudden, because the moment it travels, bang, it goes up directly into the brain. Do you understand? Okay, is that clear? Okay? So sudden onset, gradual onset, and then of course, AF or any form of what? Arrhythmia. What about damage to the valves? Can that also form a clot? Of course. Because why? The blood will keep on going back and forth, regurgitation. It's a mitral valve regurgitation. Have you heard of that disease process? Mitral valve regurgitation. When the valves are destroyed. So regurgitate means backflow, because normally a valve, what does the valve do? Make the blood flow in one direction and prevent what? Backflow. Do you understand? Okay? So therefore, if a patient has a stroke, due to this, are we going to treat this problem first too? Are we going to do an electrocardiogram? Yes. Are we going to do an echocardiogram? Yes, we do, because we want to find out if the valves are destroyed. We also want to know if there is what, an arrhythmia or not. Are we going to give anti-arrhythmic drugs? Anti or against arrhythmia drugs? Yes, we do. You do not only treat the stroke, but you treat the problem that is causing it. That's how we medical doctors and nurses think. We think of what is causing the stroke. Isn't that etiology? There it is. Because if you know the problem, you know the solution. Is that clear? Right? So apparently what we're trying to say therefore is that, is there a difference between the two? The source of the clot is different. But the treatment is the same. What kind of drug do we give these patients? Huh? There's a clot. What do we do? What do you want to do with the clot? Break them down, exactly. What kind of drugs are we going to give these patients? Exactly. Thrombo what? And most of these thrombolytic drugs end with what? ACE. Just like in the heart, remember? Within the first how many hours? 3 hours, the magic number. Because beyond 3 hours, the damage is permanent. Do you understand, class? Okay? Like ATPase, streptokinase, abukinase, urokinase. Okay? Now, what's the difference between that and anticoagulants? This is going to dissolve the clot. What about anticoagulants, like heparin and warfarin? They prevent what? Further clot formation only. They cannot dissolve the clot. What about antiplatelet drugs? Example would be what? What is ASA? Acetyl salicylic acid. What is ASA again? Acetyl salicylic what? Acid. That's right. ASA. Is that aspirin?
Yeah.
So I'm just telling you this because in the nursing board exam, what if they don't use the word aspirin? And one of the choices was ASA. Is that the answer? You understand? That's why people with heart disease, sometimes they give aspirin, Bayer aspirin, right? Okay. So that's ASA. What does an ASA drug do? Prevents the platelet to aggregate. Now what is the role of the platelet in clotting? See this? You have a wound here, right? There's a break in the skin. What happens to the blood? Oh, it is the blood vessel. The blood gets out of the blood vessel because you have a wound. It destroyed the wall, so the blood goes out. What will the platelet do? The fragments. They become what? They aggregate. You know what aggregate means? They clump together, and what do? What did they do? PLUG. To seal off what? Seal off this wound. Isn't it amazing what the platelet can do? And create the clot. But in clotting, you don't just need the platelet, but you also need what? Clotting what? Factors. Now let me ask you this. Where do you form the platelet? What produces the platelet? Which one? Can you just tell me red bone marrow right away? Right? What about the clotting factors? Where are they produced? Very good. I think this is a very smart class. I can tell the difference. You know the difference between clotting factors and platelets. Very good. Okay? Now, hemorrhagic stroke. The rupture of what? Or bursting of what? Cerebral arteries leading to a stroke. Okay? So what's the most common cause here? Hypertension. What is hypertension? When your blood pressure is 200 over 100, is that an hypertensive emergency? And that happened to my father. My father was 62 years old when he suffered a stroke. He was in the bathroom or toilet. What do we do there? He was trying to move his bowels. Then guess what happened? He was constipated. Guess what he did? He did what we call a strain, or what we call Valsalva maneuver. Valsalva maneuver. His blood pressure went up to 200 over 100. Arteries ruptured. He had what? Sudden or gradual?
Sudden.
Onset of what? Hemiplegia. Now it was 5:30 in the morning. Everybody was asleep. The good thing, he was able to use he was suffering a stroke on the right, paralyzed on the left. He used his right foot to kick the door, and people were able to help him. Okay. Now between these three, what is it that would make a big difference? Which one is more life-threatening, hemorrhagic stroke or an ischemic stroke?
I'm sorry, hemorrhagic is more fatal.
Why? Why?
Because of the second injury, the body's
Yes.
because it's a secondary injury, so the body's response.
So give me a specific scenario. What happens here? What would be side effect of this?
Low blood pressure.
Huh?
Low blood pressure.
Huh?
Cerebral edema.
Edema. What else? So you have what? Both will have brain swelling. All three of them. It's called cerebral edema, or swelling of the brain. But what else?
Increased intracranial.
Very good. Increase what?
Intracranial pressure.
So which one has blood?
Hemorrhagic.
This one is bleeding. Here, you only have a blood clot in the brain. Arteries. Here, the actual artery became what? Ruptured. Will that blood occupy space?
Yes.
Will that become a space-occupying lesion inside the brain? Now, why would there be increase in the intracranial pressure? See, have you ever noticed that what I keep on asking my students? What's the first question I always ask? WHY. You understand? Why? Why would there be increase in the intracranial pressure? The answer is simple. Huh? The rupture caused the increase in the intracranial pressure of the artery, but why would there be increase in the intracranial pressure in the first place? Yes? It occupies space, okay? Give me a very plausible explanation. This is supposed to be a teach back. I'm supposed to learn from you guys. What have you learned in your readings? Anybody? Okay. It's very simple. If you do this, everybody do this to your scalp. Is it hard? Okay. Now, imagine that you can go and grab your brain, which we did in the anatomy class, right? We saw the brain of the ship, right? Was it hard or very soft?
Soft.
Very simple. The skull is hard. The skull is hard. This is the skull. This is the brain that's soft. Okay? Now, in the skull, where is the opening? Where is the foramen in the skull? The foramen magnum at the base of the skull. Foramen means hole. If there is bleeding inside the brain, now does the brain occupy space?
Yes.
It does. So when you have bleeding there, when the arteries rupture, will the blood occupy space?
Yes.
Too. Yes, it will. Now if you know your physics and you know your math, they will now be competing with what? A limited space. There's blood, there's brain tissue, blood. What kind of bleeding will this be? Arterial means what? Fast and Furious or Fast and Furious? You like that movie? Fast and Furious bleeding? Like a fountain of blood, you can just imagine. I just want, one of these days, I want to be very small. I want to watch a artery about to rupture. I have this crazy idea. I want to be a very small nanoparticle, and I'll be watching, I will be inside your brain and watching. Oh my God, it's about to rupture. What a beautiful scenery. And all the blood will be like the Kilauea volcano there in Hawaii. the lava, the molten blood, and they're going to be swimming in the blood, you know. Now the problem is that the blood will occupy space. Can it be able to escape? No, why? There's what? There's skull. But where is the space that has a hole? So when there is increase in the intracranial space pressure, the brain will be pushed up or down into the foramen magnum.
Down.
And what do you call that condition when the brain will descend into the foramen magnum because of the increase in the cranial pressure? What is that called? Who said brain herniation? Is that you, Mr. Angeles?
Yes.
Are you the one who said brain herniation?
Yeah.
And what is brain herniation again, Mr. Angeles? Matt?
When brain tissue protrudes out of an opening.
The brain tissue is going to descend towards where?
Towards the foramen magnum.
Why the foramen magnum?
Because it's the only opening.
And so far, if it's an opening there. Is it the area of least resistance?
Yes.
Yes, it is. Like when you were a baby, where did you come out? Miss Romero, when you remember when you were a baby, Miss Romero? Were you born by spontaneous vaginal delivery?
Yes.
Did you ask your mom? Mom, was I born CS or vaginal delivery? What did your mom say?
Normal delivery.
Normal spontaneous vaginal. We call that SVD. Spontaneous vaginal. No, I'm just joking about the mom. When the mom delivers the baby, there is what? An opening there called the birth canal. That's why you come out there. Same thing with the brain. The brain is going to be delivered like a baby through what? The foramen magnum. The problem is this. When the brain herniates, now remember, what is the last part of the brain above the spinal cord? The medulla oblongata, right? Let's pretend this is the medulla oblongata. And the foramen magnum is here. When the brain is going to descend because of brain herniation due to the increase in the intracranial pressure, due to the hemorrhagic stroke, guess what? What did the foramen magnum do to the medulla oblongata? Yes? Compress. And the moment you compress the medulla oblongata, you stop what?
Breathing.
And you will rest in 6 feet under the permanent resident at Forest Lawn Cemetery. Why did you die? Why did you stop breathing? Because what is the function of the medulla oblongata? Control breathing is the respiratory center of the brain. What am I trying to show here? There is no answer that you cannot answer in the nursing board exam because you have mastered anatomy. And if you master anatomy and physiology, if you know what is normal, exactly. Do you realize that? If you just really know your anatomy and physiology, there is nothing that you cannot answer. You can even get a perfect score in that nursing board exam. I'm so excited for all of you. Your class must get a perfect passing grade, right? All of you should pass a green light and take the exam within 30 days. Yes, ma'am. You have any question?
Can increased cerebral intracranial pressure happen from an ischemic stroke too?
Of course!
Because of the inflammatory response?
As I told you, you can have brain swelling here, brain swelling here, brain swelling here. Will there be increased intracranial pressure here too? Yes. Will there be increased intracranial pressure here? Yes? Yes. Will there be increased intracranial pressure here? Yes? Yes. But between the three, which one will be faster and furious?
But how does the body compensate for it? Like, does it constrict?
So this is even the worst. What is going to happen? Like in my father, when he's had a ruptured artery, the worst thing that happened was the doctor, unfortunately at that time in 1988, the place where I go, there was no CT scan. So what happened was, they thought that she suffered from what? What's the most common stroke? Thrombotic, embolic, or hemorrhagic? 60% of strokes are thrombotic. But there was no CT scan, so she relied on statistics. So she said, oh, thrombotic. What did she give my dad? Aspirin. Are you going to give aspirin to a hemorrhagic stroke? Did my dad get better? I was having my residency training. In fact, before he suffered a stroke, actually I wrote him a love letter. I said, my dearest dad, I don't want you to suffer a stroke. High fiber diet. What is the high fiber diet for? Prevent constipation. Did he follow my advice? He did not. Being a good father, you know. I told him, if you're constipated, so I look at the possible scenarios. So let's say you did not follow my advice. What about if you're constipated? What do you do? Over the counter, stool softeners, and then what? Laxative, milk of magnesia, whatever, like Dulcolax. Did he follow my advice? He did not. So on that fateful day, he strained, artery ruptured, he had bleeding. Now, why is it more important that you know this? Because the treatment is different. You don't give aspirin. The goal is to stop the bleeding, know where the bleeding is, do a CT scan, and then if there is so much blood, you can what? Drain the blood to decrease the intracranial pressure. Now, here, there's no blood to drain. Here, there's a blood that you can drain if the blood is accessible. If the bleeding is not deep, then you cannot. It's not accessible. There's nothing you can do. Stabilize the patient, control the blood pressure. That's all you can do. Does that make sense?
I meant like the brain's mechanism, like autoregulation. What does it do when it increases?
Well, the brain will try everything to make the blood flow, but remember, the artery already ruptured. There's nothing you can do. There's already brain swelling, right? So whenever there's brain swelling here, it's the same all throughout, but the worst case scenario would be here. Now, what can the body do to be able to counteract this? There's nothing that the brain can do. Because it's a ruptured artery. Can the brain heal itself? That's the reason why we are here to treat the patients. What do we do to control the brain swelling? Let me see if you have read further. How do we control cerebral edema and brain swelling? Or cerebral edema means swelling. Edema means what? Fluid. Blood and fluid. Yes? Well, we can't drain anything here because there's nothing to drain here, right? Let me see if you have. Now, I know.
But to reduce the cranial pressure, you would drain it, right?
If this is a blood that can be accessible, you can put craniotomy and drain it, right? That's what they wanted to do to my father. Anybody?
Doesn't the body's is the cerebral spinal fluid that absorbs it or something?
Well, remember this is brain swelling. It's a different problem. The cerebrospinal fluid is found inside the subarachnoid space.
Steroids?
Well, steroids could be, but aside from steroids, anti-inflammatory swelling, yes, brain swelling, yes, but we give steroids for this, but what else? It's called have you heard of Mannitol?
Oh yeah.
Where did you hear? Where did you read that?
I know that because family member has a heart problem. So.
Okay. Mannitol is what? Osmotic diuretic. What does that mean? Whenever there's brain swelling, what do you mean swelling? Of the brain, there's what? Edema. What is edema? Fluid. The blood has plasma, fluid, water, right? So when you give a mannitol, the diuretic, what does it do? It removes the fluid in the brain to go where? In your wee-wee, in your urine. The only problem is that the moment you give a diuretic, can that lead to fluid volume deficit disorders and problems and electrolyte disturbances. So whenever you have diuresis, you have to watch out for this. That's the reason why you as nurses, you have to watch out. Whenever a patient is being given mannitol, make sure you're aware that it can cause a lot of complications. So we monitor what? Urine intake and output of urine and intake of fluids, both IV. Second, what else? Electrolyte disturbances, whenever we give mannitol. Is mannitol the drug of choice to control the brain and swelling? Yes, aside from steroid preparation, yes we do. Do you understand? Is that clear? So, how do you know a patient has increased intracranial pressure? Based on the signs and symptoms of this patient. How do you know that there is an increase in the intracranial pressure? Anyone? Yes?
Headaches, stiffness.
Okay. First, they have headaches, right? And they can have what? Projectile vomiting. What's projectile? Have you seen that movie by Exorcist? Exactly. Linda Blair, the first original one when I was a young kid in high school. Projectile. This will come out in the nursing board exam. It's called projectile vomiting. Unlike it, that's not projectile. You mean the green vomiters that she did? The Exorcist movie. That's the best in the West. Okay, so it's that projectile vomiting, yes, headache. And most importantly, what is it that you're supposed to monitor among your patients? Perfect. Yes, you have to. Hi, what's your name? My name is Dr. Gama. Where do you live? I live in Anaheim, the happiest place on earth. Why? Because Disneyland is there. How old are you? I am 47. Actually, I'm wink, 57. I just want to look younger. Now, after 1 hour, what's your name? What? How old are you? 37? I can't remember. So he becomes drowsy. And then stupor, and then what? Coma. How do you know what's coma? Because when you do a sternal rub, there's no response to pain, right? So do this, there's nothing, no reaction. Okay. Normally you have a withdrawal reflex, but there's none. The bottom line is that whenever there is an increase in the intracranial pressure, you would expect to have an alteration in the level of consciousness, from being awake and alert to becoming what? Drowsy, to become stupor, stupor to coma. Bad or good? Bad. And there's always a basis for that. When there's increased intracranial pressure due to a ruptured artery with bleeding or brain swelling, which happens in both three cases, it has to do with involvement of the reticular activating centers in the brain, which I don't know if I mentioned this partly in the lecture on anatomy in the brain. It's called ascending reticular activating system. Okay? So what am I trying to show here, class? Whatever happens to your patient, there is always a scientific explanation. The reticular activating system, and it's called ascending because it ascent. It's the one that controls your consciousness, your being awake and alert. The moment it is affected, you become stuporous to comatose. And why would this be affected? Because why? There's brain swelling, and in this particular case, hemorrhage. So in other words, which is more life-threatening, hemorrhagic stroke or ischemic strokes? But all three of them can be a problem, right? You understand what I mean? Okay, is that clear? And notice here, why is it important to do a CT scan or diagnostics? Because can we give a thrombolytic drug here? Yes. What about thrombolytic drug here? Yes. Can we give a thrombolytic drug here?
No.
And that is how you fail the exam if you said yes. Because you're actually going to kill the patient if you give a thrombolytic drug. That doctor who gave my father an aspirin here in my father's case, did she do the right thing? She almost killed my dad. So what happened was I brought my dad, I had to buy 6 seats for the plane, you know? When you have to put a patient on a plane, we don't have any airplane ambulance, so if you bring a patient from one city to the other city, you have to buy 6 tickets, or maybe I say 8, because they have to put the patient on that, okay, with the bed. Okay? So the problem is that I could have lost my dad if I did not intervene because they were giving them the wrong treatment plan. So can doctors make mistakes too? It's called doctor-induced death, TID. No, I'm just kidding, there's no such thing. It's just called malpractice. Well, it was the woman was a close friend of mine. She was actually older than me by 10 years, but I didn't bother to file a case because, you know. Do you understand the difference, right? Okay? So the bottom line, therefore, is that when there's increased intracranial pressure, it leads to brain herniation. Is that reversible or irreversible? Irreversible. There's nothing you can do. Can you push the brain upward? Okay, brain, yoo-hoo, go up, go up. Nothing you can do. And your patient will die because they will stop breathing, believe me. Okay? How do you know that the brain is herniated? Because you do the CT scan or MRI. And the group will talk about that. Okay? The difference between that, CT and MRI. Okay? Now, what about traumatic brain injury? Is there a difference? Of course, there is a difference, right? Why? Because in traumatic brain injury, the problem is what? What causes the injury to the brain?
Either primary or secondary trauma.
Okay, trauma, primary or secondary. The coup versus contra coup. So what is the cause of traumatic brain injury? Trauma. Right? Right? So in TBI, there are many examples. You can either have epidural, hematoma, and what's the other one? Subdural. Okay? Let me stop this first so that we can have easier to upload.